I'm Caitlin, and I was unable to get my clinical checkoff done at the lab. I was unable to go on Tuesday due to my boyfriend still having to work, and there's no other times until Friday, so I tried to come up with something at home that I can do. I do have some tools as this. It is the IV venipuncture flush. That does have veins right here to use. I have my patient, Mr. Spike here, and then I have all of my equipment in my sharps container over there. So I'm gonna do my checkoff, or at least attempt, whether you accept or for now, or if I need to go in and use the mannequin arm. I completely understand. I just wanted to make some type of effort. All right, so I'm gonna go ahead and start. All right, so knock knock. Hi, my name's Caitlin. It looks like you have a order to place an IV today. That way we can get some medications going. This is just going to be a little pinch into your arm. The needle doesn't really go in. It doesn't stay in. It's just going to be a catheter. Now, can I get your name and date of birth, please? All right, Mr. Spike, 13122, perfect. That is what I have here on the order. And then, do you have any allergies, sir? No? Okay, anything, sensitivity, I'm sorry, to chlorhexidine, latex? No? Perfect. All right, so I have all of my equipment right here. It's gonna be my bedside table over here. All right, so I'm gonna go ahead and open this, just get the tourniquet out. Go ahead and place this on your arm to find your vein that we're gonna use. All right, I'll show you what that looks like right here. Can't see if you can see it. There we go, there's the tourniquet. All right, so looks like I'm gonna use this one right here. I'm gonna go ahead and pull that tab there. All right, I'm just gonna go ahead and get all my stuff set up, and then we'll go ahead and start, Mr. Spike. All right, let me get this ready here. Let's loosen this cap just a little bit. I'll take it off. Okay. Let's open that, open this all the way. Perfect. I put what we're going to call our Chuck's towel underneath here. All right. So I'm going to go ahead and start putting on my gloves. Okay. I'm going to go ahead and cleanse the area with the chlorhexidine. Got my trash right there. Okay, and then I would clean this for 30 seconds. And on here, it's not really going to dry quickly. So go ahead and toss that in there. All right, now I do have the alcohol pad. If he was sensitive to chlorhexidine, I would just do that in circular motion, but he doesn't, so we did that. Gonna let that dry. Gonna reapply your tourniquet here. There we go. All right, so I'm gonna go ahead and inspect his catheter here. Everything looks good. All right. So I'm gonna go ahead and stabilize the vein with my non-dominant hand with the bevel up. I'm gonna go ahead and insert just until I get blood flash, sorry. However, in this little flash, I do not have any food dye or anything, so there's not going to be any. Okay, So then I'm just going to go ahead and push with my dominant finger, push the catheter in, which pulls the needle out. Not all of the way though. I'm going to loosen the tourniquet. I'm going to quickly disengage this, activate the safety. I'm going to attach the saline, I'm going to aspirate, which I'm not going to get much because there's nothing in there. And then I'm going to go ahead and flush with 3 milliliters of saline. So that's what I'm doing right here. All right. I'm going to go ahead and unattach that, discard that in my sharps here. Now because of this mannequin, it does slide very easily. Okay, I'm gonna go ahead and get my tape on here, which again does not stay very easily on this. Okay, that's all trash. Oh, that is trash as well. I'm gonna go ahead and tape this. All right, and Mr. Spike, do you have any pain? No, okay, there's no swelling here. If I can get this off. There we go. I'm gonna go ahead and tape this here just to stabilize that. Okay, I'm gonna go ahead and remove my gloves. I'm gonna go ahead and date today is 2/17. It is 1440. My initials, and it was a 22 gauge. All right, and then I only had one attempt, and then with this I will go ahead and document the procedure, how everything went, how the patient tolerated it, and the gauge that was used. Oh, and the insertion site.